Everybody's ready. Good morning, everyone. I'm Adrian Dix. I'm BC's Minister of Health. Before we begin, I'd like to acknowledge that we're on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands, and I'm here to welcome us today and opens today's event in a good way. We have Shane Point, a Musqueam knowledge keeper. Over to you. Thank you, sir.
Unmasked. Good morning, everyone. Oh, beautiful day. Beautiful day. I'm standing with Penny. Penny's a survivor. Like many of my sisters, my cousins throughout British Columbia, they've survived. And they've had the excellent care from caregivers who provide solace and medicine from cancer. I'm proud to stand with her today, as I am with the other luminaries. Oh, Thichwam, see you and not sastli quam thet squall winds CM cancer oh not samat Sali, British Columbia, Sast Tamaminas, cancer, oh, Thichwam, square, quam, thet, oh, my dearest friends, my relatives, in the chant, I'm asking the infinite to please, please, please lift up the spirits. Lift up the spirits of the ones who are here today doing the cha-cha sacred work for those of our relatives and our friends who have cancer, asking to lift up their spirits so that they're strong. Quam, stronger, quam thet. Asking the infinite to please provide strength to the emotions of the ones who are doing the work. Cha-cha, sacred. Cha-cha, yayas, sacred work. Many of us in our families, we've had loved ones who've suffered with cancer. It's through the efforts of the luminaries here today that they're more comfortable. They have words to lift them up, to provide them with success so that they're okay in their hearts and their minds. I'm also saying sunlight, daylight, squale, beautiful sunshine today. I'm asking the daylight to please give these wonderful people the strength that they need from the sun and the daylight to continue to move forward in the same canoe, Nutsamot. We in British Columbia are all one. Nutsamot, we are one. First Nations people and all others from around the world who are within our boundaries, Nutsamot, we're all one. Working towards the comfort of others, providing them with peace of mind and spiritual strength. Thank you, thank you, thank you.
Thank you, Shane. Thank you for sharing your knowledge and with us today. It's important as we discuss this transformative work that we're doing here in BC to acknowledge, I think, all of the work we have to do together. One of the most moving moments, I think, you were there, Shane, was when a number of years ago we started to put in place our Indigenous cancer strategy, and we've been truly blessed by your knowledge and support today. Thank you. Thank you. We have some great speakers today, and I wanted to let you know who you'll be hearing from. Of course, Premier David Eby will be speaking. Dr. Kim Chi, the Chief Medical Officer of BC Cancer, and Heather Findlay, the Chief Operating Officer of BC Cancer, will be speaking. Sarah Roth, the President of the BC Cancer Foundation, and Penelope Hedges, who will describe and share with us her story and experiences battling cancer. I want to acknowledge many other people in the room. I want to acknowledge Tim Manning and the PHSA board who have been so much part of this effort. I want to acknowledge all of the contributors who are in this room, but the thousands, the tens of thousands across the province who are contributors and supporters of the BC Cancer Foundation. I know some of them here today, and we are honored to have you here. I want to thank the staff behind me, but also all those working in this building and across the street and in dozens of centers who right now are supporting people with cancer, members of the Hospital Employees Union, the HSA, Health Sciences Association, the BCNU, the Doctors of BC, who have made this work not just their job, but their calling. And we're thinking of them and feeling that effort today. And part of what we're trying to do today, I think, is to recognize how much cancer affects all of us, and it does. And our commitment remains to ensure everyone in BC gets the care and support they need when they receive that difficult diagnosis, that day when it comes, and every family can remember it when it happens to a member of their family, when that day comes of diagnosis, that they get the care and the support they need, and that we take the steps we can to prevent cancer in the future. So without further delay, it's my honor to introduce the Honourable David Eby, Premier of BC.
Thanks very much, Adrian. I'll join you in acknowledging the territory of the Musqueam, Squamish, and Tsleil-Waututh people, and thank Elder Point very much for starting us off in such a good way. There's a couple people here I'd like to recognize, Dr. Kim Chi and Heather Findlay, who are here from the BC Cancer Centre. Thank you for your work on this, and thanks for joining us this morning. And Penelope Hedges for sharing, who's joining us today to share her story of cancer. Thank you for joining us. It's true for most British Columbians when they think about cancer, and certainly for me, that it is one of the greatest healthcare challenges that we face. Whether it's as a patient, as a family affected by cancer, whether you're a health professional delivering care, an incredibly difficult and emotional job. 1 in 2 British Columbians will face a cancer diagnosis in their lifetime. an astounding statistic. And nearly every person will be affected by cancer in some way, whether through their own personal battle or that of someone that they love. I was 20 years old when my family lost my cousin Liz to cancer, to childhood leukemia, and the world was deprived of a light. Although we lost Liz, her memory lives on with us, and I know our family's not alone in that. Had she been diagnosed today, 20 years later, 26 years later, it might have been a different outcome. And that's because of research, advancements in treatment, and the dedication of, in fact, many of the people who are here in this room today. The burden of cancer is increasing around the globe, and BC is no exception. Our population is growing. Our population is aging. And we see more and more people facing a cancer diagnosis. We see it in human costs, the toll that it takes on people facing that diagnosis and those who love them, but also in healthcare costs for our province. Thanks to advancements in preventing, treating, and even curing certain cancers, more people are surviving their diagnosis and living longer and better lives. That's the good news. The challenge is that this increased demand has led to a situation where our cancer care system is stretched. In some cases, it's at capacity. And in this province, we will not accept people's cancer care being compromised by long wait times. That's why we're taking action to support our public cancer care system. Some people will argue that we should deal with healthcare strain by allowing people to buy their way to the front of the line. That doesn't change the fact that there's a line. It just changes who's at the front. And it threatens bringing doctors, nurses, and healthcare professionals out of our public hospitals into a parallel system, making care worse for everyone else. We're going to continue to do things differently here in BC. We're investing to strengthen our public healthcare system and doing everything we can today to take care of British Columbians and their families when they face a diagnosis of cancer. So today I'm proud to announce BC's new Cancer Care Action Plan, a plan that builds on our $1 billion in investments since 2017 to strengthen cancer care. This plan focuses on better prevention, earlier detection, and improved access to treatment. These actions will save lives and ensure people live longer and healthier lives. With cancer care, they can count on both right now and into the future. In total, we are making an initial investment of $440 million. $270 million will go towards taking immediate actions for better cancer care, including expanded hours of care, so people can get faster access to screening, treatment, and radiation appointments. A new compensation model for oncologists to help recruit and retain more doctors and reduce waits. More funding for people living in rural and remote communities to help cover costs of travel to appointments. Improved screening programs to help better detect cancer sooner. And adding more Indigenous patient support positions to provide better, more tailored care for Indigenous people. We're also making a significant investment of $170 million in the BC Cancer Foundation. This will support cancer research and improve access to specialized treatments, including increased clinical trials that study treatment approaches requiring fewer visits to hospital, enhanced genomic testing to deliver the optimal treatment for every single patient, expanding access to innovative cancer treatment options, including new diagnostic and therapeutic options, supporting cancer treatment and the people studying emerging cancer care options. I've asked our health minister to do what it takes so that no British Columbian has their cancer care compromised by long waits. That's why in the coming months, we will build off this investment with additional funding to support our goals and to deliver care. These include securing a cancer-free future for more people, including our goal of the elimination of cervical cancer in BC, helping thousands more people survive cancer and extend the duration of quality of life for those with cancer, as well as ensuring BC's cancer system delivers efficient, modern, evidence-based care. As we approach the end of the first 100 days, it's investment like these that will have long-lasting impact for British Columbians. This is all part of our vision for a BC where everyone can build a good life, where people get the care they need, when and where they need it, and where we build a stronger BC for everyone. And we're just getting started.
Thank you, Premier. I always feel like they're partly applauding for us, partly for seeing the podium move. So I think that's a good thing. It's this is for me, and I think the people who work in this building and the people who care about cancer in BC and their families, a really important and historic day. We've been in a period of where we've made remarkable and transforming investments in cancer care. But this takes us forward to the next 10 years, says to everyone that we see the future, and it is a better future for people, that we're going to take the actions needed now and in the long term, which has sometimes failed to happen in our healthcare system, to ensure that the next generation and the generation after that have the care they need. As you know, we've taken a number of actions, and I'll just describe some of them over the last number of years as a government. In fact, today's announcement builds on over $1 billion of investments and efforts since 2017 to support the creation of a strong and sustainable cancer care system. That means the addition of over 325 full-time equivalent positions, including physicians and clinical support staff with BC Cancer. The launch of the lung cancer screening program, which was a historic day that we recognized in this space a short time ago, in which thousands of British Columbians have now benefited. The addition of Indigenous patient navigators at each cancer centre in BC, and the improvement of data as part of our Indigenous cancer plan that is strongly connected with our colleagues at the First Nations Health Authority. By bolstering our workforce and improving access to cancer care services, we are preparing for the growing needs of the future, while ensuring our loved ones receive the best possible care today. Because we know how important it is to spend time with the people that we love and that you love. We are working every day so that we all have more of that time. Our next speakers have played an important role in the work we have done. They've been key to the development of this plan. They are extraordinary leaders in their own right. I'd like to invite Dr. Kim Shee and Heather Finley from BC Cancer to share some remarks.
Good morning. Thank you, Minister Dix and Honourable Premier Eby. Dr. Shee and I are thrilled and humbled to be a part of today's announcement. We are here today as the leaders of BC Cancer, and we are also proudly representing more than 3,000 dedicated and committed healthcare staff, care providers, and researchers throughout British Columbia. I can say in full confidence that today's announcement is being celebrated and applauded at all of our cancer centres at this very moment because of what this will mean for the patients we provide care for. To BC Cancer's staff, care providers, researchers who have continued to rise to the challenges of the past few years, we celebrate with you today. While we are most appreciative of the annual funding that we have received from the provincial government, what truly is different about today and this announcement of the 10-year Cancer Action Plan is that we have a way forward for multiple years that will allow us to make solid and sustainable plans for the future. It allows us to take a proactive, longer-term approach to planning and delivering high-quality, timely, and innovative cancer care in British Columbia. It allows us to further engage with our partners, knowing that the support and resources required for this transformational change will be there. This is not a BC Cancer plan. This is a cancer plan for the people of British Columbia. We all own this, and we all have a critical role to play. On that note, our partners are vital. This includes academic institutions, training the next generation of talent and driving innovation, Provincial Health Services Authority and our health authority partners who help support the delivery of care, and of course, the BC Cancer Foundation, our fundraising partner and their incredibly generous donors. Thank you all for what you do, and we look forward to rolling up our sleeves and getting to work.
Thanks, Heather, and thank you, Minister Dix and Premier Eby. It's certainly a real pleasure to be able to take part in this announcement today. As my patients, friends, family, and anyone will attest to, getting a diagnosis of cancer is a life-changing event. However, more people are being cured, living longer, and living better after a cancer diagnosis than ever before. And this is because of the rapid pace of research in cancer biology, genomics, and treatment, often led by some of our own brilliant minds here in British Columbia. I've been an oncologist with BC Cancer for almost 25 years. And I can say without reservation that today's announcement of investments in cancer care and the Cancer Action Plan are unprecedented. This is really a defining moment that puts BC on a transformational path as leaders in cancer care for the benefit of patients and families across BC. The Cancer Action Plan places patients' needs at the center of it and touches all aspects of the cancer care continuum. The long-term outlook of the action plan is critical, allowing us to develop strategies for now and the future that will address the increasing burden of cancer care that we are all facing. The investments and action plan also recognize the leadership and international reputation that we have here in BC in cancer research and the importance that research and innovation play in delivering high-quality cancer care to all. There are so many people to acknowledge for bringing us to where we are today. Thank you to Premier Eby and Minister Dix and Deputy Minister Stephen Brown for your leadership in advancing cancer care for the people of BC. Thank you also to Dr. Penny Bellum, Dr. Maureen O'Donnell, Christy Anderson, Dr. David Byers, and Susan Wanamaker, and all of the folks within the Ministry of Health, PHSA, and BC Cancer who have worked so closely with us on the development of this plan that have made today's announcement possible. Thank you all.
Thank you, Heather. Thank you, Kim, for that. What we have at BC Cancer is extraordinary leaders. We have at the PHSA are extraordinary leaders. I want to note David Byers and Susan Wanamaker, who have been so much part of this, working with the PHSA. They are leaders in the truest sense. They are both brilliant and compassionate. And what is reflected in the plan that you'll see, the detailed plan that you will see, is their work and both their, I think, vision and their compassion and their real. They live their work, and I think their generosity is expressed in this plan. I wanted to acknowledge another partner who I'm going to ask to speak in a few minutes. And you have the privilege, when you get to be Minister of Health, of meeting extraordinary people who do different things. And not that long ago, a few months ago, our next speaker, Sarah Roth, and I had a coffee at Trees Coffee Shop next to my constituency office. It's just a shout out to the folks at Trees. And we talked about what we could do. I think that what the BC Cancer Foundation, which is in terms of contributions this year, are the leading charity in British Columbia, which shows its base in communities. It represents contributions in the millions and $5 contributions, all of which the foundation, I think, treats as important and essential to them. And we talked about at that time what we could do to make this plan even stronger and better, what role we could do to build out to the community in the BC Cancer Foundation. Sarah Roth was an important part of what we're announcing today, and I'm honored to introduce her to say a few words.
Thank you, Minister Dix. I think that was the best coffee I've ever had because it turned into a $170 million grant. So I look forward to the next one. Good Good morning. It's just such an honor to be here on behalf of the BC Cancer Foundation and accept with honor, privilege, and responsibility this extraordinary grant. Thank you, Premier Evie and Minister Dix. So 85 years ago, the BC Cancer Foundation was born, and it's incredible to see what's happened since then. And actually, there was a donation that funded the very first patient to receive care at BC Cancer 85 years ago. So I think that shows you the power of philanthropy, and that has continued. Today, we stand in the L.J. Blackmore Cancer Research Center, a building funded through philanthropy, and there are people in this room that played a major role in that. BC Cancer Foundation donors fund the scientists, there are hundreds of them, who work tirelessly to find new treatments and new discoveries. 40 years ago, if you received a breast cancer diagnosis, your survival rate was about 60%. Today, it's over 92%. The lab here in this building has been at the forefront of identifying that breast cancer is actually not one type, but more than 10 subtypes, which has led to faster treatments and, in many cases, cures. You will hear soon from a patient who has an ovarian cancer diagnosis, one of the hardest to treat cancers. The team at BC Cancer, again funded by the BC Cancer Foundation, discovered several years ago that actually ovarian cancer doesn't develop in the ovaries, but in many cases in the fallopian tubes. And as a result, there is now a global movement to remove fallopian tubes for women at high risk. That is prevention in action. And my last example, and Dr. Chi doesn't know that I'm going to highlight his work. Not only is he the busy chief medical officer at BC Cancer, he's also a renowned expert in treating prostate cancer. And he holds a donor-funded research chair, which has allowed his team to really pursue how can you better treat metastatic prostate cancer. And they've recently discovered that through a simple blood test, you can detect the cancer, which can inform treatment rather than a more invasive biopsy. These are just a few examples of how donor support have advanced innovation at BC Cancer. In the fall, we launched our $500 million, the largest campaign in British Columbia's healthcare history, a campaign called Beyond Belief. And now, with this partnership with the government, which is a long-standing partnership, we are very confident that very soon we'll be at a place where we no longer fear cancer. Thank you.
Thank you very much, Sarah. And thank you for all the work you do and all the people around British Columbia who make the BC Cancer Foundation what it is, which is a big organization and a community organization, and that's an exceptional thing. I wanted to now have the opportunity, you get to be the closer, Penelope, which is great, to introduce a cancer survivor who is here to tell her story. I wanted to introduce Penelope Hedges.
I'll give 15 seconds for my glasses to recover. Thank you, Premier Eby and Minister Dix. Good morning, everyone. It's a pleasure to be a part of this exciting announcement today. My name is Penelope Hedges. I'm one of many patient and family advisors working with BC Cancer. I've cared for family members with cancer, and I myself am also a cancer survivor. My journey started with BC Cancer in 2012 when I was diagnosed with ovarian cancer, and just as an aside, I'd had a hysterectomy a few years prior. Today, having that hysterectomy, my fallopian tubes would likely have been removed, but at that time, we just didn't know. Other than a few symptoms, I was not really aware of having cancer, but the surgery and chemotherapy I received made me feel awful. I was in a cycle of appointments with blood tests, meetings with oncologists, treatments, taking drugs to combat the side effects of the treatments. My whole psyche was wrung out. At the end of 4.5 months, I hit a wall, emotionally, physically. But I was grateful for the lovely nurses at BC Cancer who provided compassionate care with a touch of appropriate humour. Recovery from cancer is never easy. I was left with significant symptoms that affected my brain's executive functions, my memory, and my concentration. While I was learning to live with these symptoms, I began to work with groups who were bringing the patient viewpoint to educating healthcare professionals. I believe that cancer care needs to shift from being disease-centred to being patient-centred, and that's why I chose to become a patient and family advisor. I was encouraged to speak my mind, and I did. My wife expressed horror when I told her some of the things I'd said at meetings. But this honesty and willingness to share the raw experience of life with cancer led me to being invited to become even more involved. At some point, I connected with Dr. Pippa Hawley from BC Cancer, who invited me to join her pain and symptom management group. Again, I spoke my mind, and again, I was invited to join more working groups and research projects. Throughout it all, I've been treated as a respected and valued member of the BC Cancer team. When my cancer reappeared in 2018 and I became an active patient again, the work I was doing became even more important and a real source of pride. I started to see firsthand some of the improvements we had been talking about at our meetings. Patient and family partners play an important role in bringing healthcare professionals back down to earth from time to time. We listen into their discussions and we ask what may seem like a basic question, but that can result in a rethink of an approach or a clarification of thought. Today, I'm seeing these discussions result in changes to broad standards of care. Since my first experience, I've looked after a number of family members with cancer, some in advanced stages for whom no curative treatment was available. I've also been at my wife's side through her brushes with breast cancer, and I'm happy to say she's doing very well now. This work has given me a way to say thank you for my care and to thank those who have cared for my loved ones. I'm grateful to be here today on behalf of all BC Cancer patients and family advisors to celebrate these fantastic new investments. With this new funding and BC Cancer's commitment to keeping patient and family voices at the forefront, there's really no limit to what we can do to improve the lives of people with cancer in this province. Thank you.
Thank you very much, Penelope, and thank you for sharing your story with us many times, but with everyone today. I think it reflects the stories of tens of thousands of people every year. Every year, more than 30,000 people are given a cancer diagnosis. That number will increase in the coming years to 40,000. As we look through the next 10 years. That is a significant challenge, but also, I think, what we have here, inspired by the people here and the people across BC, is a plan to prevent, a plan to detect and to detect sooner, a plan to treat, a plan to support and to research, and a vision of the future that isn't just about numbers and demands and the number of people in the province over 75 and the increase in age-related cancers and the number of people coming here, but in fact, to make life better for people, to make their quality of life better, to make living with cancer better, and to ensure that people have the support they need in their own communities. I'm very honored to be here. I'm very honored that Premier Eby put such emphasis on this plan as one of his key priorities when he became Premier of BC, and I'm also honored to welcome him back to the podium to take questions.
Thank you. Happy Friday. For media in the room, I'm Tim, standing behind me. I'm holding a handheld mic. For media in the room who want to ask a question, please come find me and start lining up here. For those on the line, one question, or you can press *1 to get in the queue. We'll do one question, one follow-up. We'll start with media in the room, and then we'll move on to media online. So we'll have this quick, awkward shuffle of people going to the microphone. And If you could say your name and what outlet you're with, that would be great as well.
Hello, Joel Ballard, CBC. My first question, a lot of the announcement talked about how this funding will create faster and improved access for patients seeking care. Can you give us a sense of what wait times look like right now?
I'll maybe pass it over to the health minister for detailed information, but what I can say is that British Columbia still maintains a very high standard of excellence around outcomes for cancer. We're second in the country for our outcomes, and that is due to the efforts of the healthcare professionals who are standing behind me and, frankly, standing behind all of us. I know from my wife's experience, the fact that they're here in the room means they're going to be working late on a Friday night. So I really want to express my appreciation for them being here and for the work they do every day. We need to maintain that high standard, and we have seen warning signs in our cancer system. Through the summer, we saw stories of people who were waiting too long for screening or treatment, and a function of a number of different factors. For example, people deferring routine screening and tests through the pandemic. Now, as we're coming out of the intensive COVID period, going in for that screening and being identified as being at risk for cancer, needing additional treatment. We've seen a rapidly growing population, more people in the province. We've also seen, we have an aging population here in British Columbia, and as people live longer, they're seeing more cancer diagnoses. So for all of those reasons, we see strains on our cancer system, and we need to respond. In terms of where we're at right now, I'll pass it over to Minister Dix to talk about that.
I think outcomes continue to be very strong, as Premier Eby has indicated. We're second in the country in terms of outcomes, and obviously we want to be first in the country in terms of outcomes. What we've seen, as Premier Eby has said, particularly on the screening side, but on the demand side, are two sets of factors, or really three. One, really systemic underfunding in the period leading up to 2017, which has changed under this government very significantly, and I think that's had a positive effect, but the overall effect of years of underfunding is felt in the system against what the actual demand is. Secondly, what we've seen is a dramatic increase in BC, different than other parts of the country, in terms of an aging population. So, and that's especially the population over 75, which creates significant increase in what we'd call age-related cancers and in demand. And thirdly, in this period of COVID-19, we had a period in 2020 when we saw a dramatic decline, for example, in testing programs that was followed by a dramatic increase after that we've seen in the last number of years. It has had an effect on people, including people deferring treatment or not seeking treatment soon enough. So there are significant demands in the system, and our goal always is to meet the clinical benchmarks, and that will be continue to be the goal in the future. And how we've done that is increase the number of oncologists and others in the system. But we've got to do a better job at that. One of the immediate actions that we're taking as of now is to make changes, for example, to ensure that oncologists in BC are paid at the top level in the country, which had not been the case, which is going to greatly assist in our recruitment. Because we know we're going to have to build out demand to continue to meet clinical benchmarks, and that's our absolute intention to do that. So in that case, just to be very specific, it's the increase in the sort of the base rate full-time from 410,000 to 472,000. And that does seem like a lot of money, but if you need cancer care, ensuring that we can recruit now and into the future is critically important. So we have created we're creating a significant number of new oncologist positions, for example, in that part of care, and we're backing it up with recruitment that demonstrates the priority that we give to it. And I think there's strong support for that throughout the system.
Great. Joel, do you have a follow-up?
Yes, please. Okay, next question. Can you break down how it will look for who want to access support in terms of having to travel down to areas that have these cancer centers? Just break down sort of what that will actually look like.
Well, we have we've significantly improved the regional supports in our cancer system. So what are we doing? We're doing a number of things from, one, big capital projects, right? So the second Surrey Hospital, long awaited, being delivered on time, will have a cancer center, and that's because of the priority given to cancer care in Fraser Health. So in addition to what goes on at Surrey Memorial Hospital, which is already a cancer center, there'll be a second cancer center there. That's on its way. Similarly, in Burnaby, at the concept plan stage in Kamloops and Nanaimo. So those are the larger centers. We also have, as part of our community oncology network, people get care such as chemotherapy, 41 locations around BC where people get care now. And one of the elements of the plan, and you saw it if you were at the technical briefing, is support for travel, not just to the major centers, but to our community oncology network. Because for many people in rural communities, they're still a long way away. So that is a significant funding increase that ourselves and the foundation will be putting in place to support people who need to travel to care. So our plan is to continue to expand the community oncology network, more locations and more places, as well as build regional cancer centers, which are critically important to the future, bringing care closer to home, and also supporting people who have to travel. So all three elements of that you can see reflected in the plan.
Great. Next question goes to Abigail from CTV.
Hi there. I'm just kind of hoping to touch back or go back to the wait times question. Is there a target you're looking to reach? If it takes 30 days to see an oncologist, are you looking to reduce that to 15 days? Is there something more specific?
Absolutely. I think there are clinical benchmarks, and I'm going to ask Dr. Chi to talk about what some of those clinical benchmarks are across the system. And it's our goal is always to meet those clinical benchmarks for starters, and to always provide care as soon as possible, of course, but to meet those clinical benchmarks. So that's a priority for us. When you see a very significant increase in demand, you have to respond to that. And that's what we're doing right now, both with immediate investments, but also addressing the situation in the long term. This is for the entire healthcare system. This is a challenging moment in terms of demand. Yesterday, there were 9,940 people admitted to acute care hospitals in BC. And while that is less than it was when I spoke to you at the beginning of January, it's still significant demand in the system. And so our goal is to, in all the different areas, and there are different targets depending on the diagnosis, to meet clinical demand in every case, the clinical requirement in every case. That's what the plan intends to do, and that's why we continue to build out our health human resources.
Do you have a follow-up? Okay. I'm just going to see if there's any more people in the room who want. Otherwise, I'm going to move over to the phone line. And again, it's *1 if you have any questions for those on the phone. Our first question goes to Mike Hager from Globe and Mail.
Hi, everyone. Thanks for taking my question. We found last April wait times to see an oncologist for your first consultation was an average of about a month. We have data from BC Cancer showing that as of January this year, it's actually up to around 43 days. So why has it continued to rise? And when can patients expect these wait times to go down, and how?
It is unacceptable to be in a situation in our province where someone is waiting for screening or waiting for treatment to the point that it's compromising their cancer care. And those are measured by what are called clinical benchmarks, which are research-based time measurements about how long someone should be waiting without compromising that care. And that is our target. It's why government, before I became Premier, supported the hiring of 70 new cancer doctors at BC Cancer. Almost every one of those positions has been filled. But it's also why we're responding to what we're seeing in the province, which is a significant increase in demand for cancer care by people who reasonably put off screening during the pandemic and are showing up now, getting screened and getting diagnosed. They need care. Population that's growing rapidly, those folks need care. And an aging population, people living longer, more likely to see a cancer diagnosis in their lifetime. A significant spike in demand. We are seeing those warning signs in the system, and that is what this 10-year plan is about. It's about preventing as many cancers as we can through the vaping initiative and our anti-smoking initiatives and our HPV vaccine campaigns to eliminate cervical cancer, and you've heard about others today. It's about treating cancer within those clinical benchmark times. It's about supporting people living with cancer. And ultimately about responding to the demand that we're seeing in the system. I think it might be helpful to turn it over to Dr. Chi to talk about those benchmarks and what today's announcement will mean in terms of the province hitting those goals and the 10-year plan, keeping in mind this is the first phase of the 10-year plan and the work that we have to do together. Dr. Chi?
The current benchmarks that we want to achieve are 90% of people seen by their oncologist within 4 weeks of referral, and then 90% of people receiving their chemotherapy within 2 weeks of ready to treat, or 90% of people receiving radiation within 4 weeks of their time to ready to treat. These are achievable goals. And with the investments that have been made over this last year, we're building towards those goals. It does take time to recruit people. It takes time to treat people. So although there may not have been an immediate change, this will happen over time. So we are in those steps to immediately change those numbers or to achieve those goals.
Mike, do you have a follow-up?
Yes, thanks. So how are you going to keep track of that progress to meet those benchmarks? And why isn't more of this made public to increase accountability and transparency? We have to leak this data. Past presidents have proposed a community council of sorts to, suggest new approaches, but also to hold the agency more accountable. Why isn't this data more public?
I think the data's. I think the data is widely available. We are and will continue to make it available. And part of the cancer plan, just as it was a surgical renewal plan, which you now know because we release those reports regularly, will be to report to the public about those issues, those very issues of wait time and care provided. What we're seeing is a dramatic increase in demand, meaning the number of people treated. And that has an effect, and it's had an immediate effect on wait times in some areas. So we will report and continue to report on this plan on a regular basis, on a monthly basis to you, so you'll be able to see the progress we're making and the progress we're making in terms of hiring, in terms of the care we're providing. And that's what we've done in surgical renewal. As you know, in that case, we've reduced the number of people on surgical wait lists. That includes cancer care. In this period of pandemic, we've met our targets. We're setting records. We've set records in January and in December for all surgeries done. We've consistently reported on that, and we'll consistently report on these issues as well.
Great, thanks. The next question, and I believe it might be the last question, depending on time, is Richard Sussman from Global News.
Premier, can you give us an update on where BC is at with signing our healthcare deal with Ottawa, with other provinces signing on? Does any of this money, could more money come to the cancer plan based on what we get from Ottawa? And for the minister, part of this is about working with oncologists. Where are you hoping to find new oncologists? Are these bringing them back into the system who have left? Is it from other provinces? Where do you hope to find these oncologists to fill that part of the plan?
Thanks, Richard. Ministry of Health staff at the Public Service are working closely with federal government officials on our bilateral agreement. I look forward to having more to say in the days ahead about our work with the federal government. It's important for British Columbians to know that we're not waiting for the federal government on this. Today's announcement, $440 million is more than $100 million more than we'll see in year 2 of the federal government's increased funding for us. So, we're going to keep pushing the federal government to at least match us in our efforts on these initiatives. We have talked with the federal government about mental health and addiction care, about home care, about support for long-term care to take pressure off our hospitals, and other key areas, including cancer. So we're going to continue to work with the federal government on that, and I'm excited about reaching that bilateral agreement with them and moving on to make sure we're delivering care for British Columbians. But for us here in British Columbia, you're going to see more announcements like today, where we're moving ahead. We want BC to be in a leadership position, not just on cancer, but on a public health care system that works for people, that delivers their care they need when they need it, everything from family doctors to acute care to long-term care and home care.
Thanks. Richard, do you have a follow-up?
Just for the second question, I'd just say that, as you know, we have a health human resources plan with more than 70 actions. At the core of that is to train more people, and we're doing that. You see the dramatic increase in the number of spaces at UBC Medical School, the new SFU Medical School, but also the training that's taking place across the healthcare team. And that's the core of what BC Cancer does. This is team-based care for cancer. So what we've seen is a tripling, and it's hard to imagine those numbers, in 4 years of the number of nurse practitioners working in BC. 38,000 more people working in our healthcare system, an HCAP program that not just met its goals, but exceeded its goals within the period in a time of a labor shortage, which is critical here and everywhere else, but in home support and in long-term care. So we have been actively and successfully recruiting oncologists to BC, but this will be as well a game changer in 3 ways. One, we've specifically improving working conditions and supports for oncologists. 2, we're investing dramatically in research, which is important to oncologists everywhere in the world. And this is a message, this plan is a message, I think, to everyone in BC, everyone in Canada, and everywhere in the world of our commitment to cancer care in our province. And I think that is a major support for all of our recruitment efforts.
Thank you. I had one job and I failed at it. Sorry, Minister. Richard, for reals this time, follow up.
I do, and an off-topic question for the Premier. Premier, you were here at the legislature a few days ago alongside Melanie Mark, who announced that she was leaving politics. There's been a lot of reaction since that. What do you make of some of this very negative reaction towards Melanie's comments that she made here? What is the sense you are hearing from people? And she's also reacted as well, telling people through social media to F off who have criticized her. What do you make of that sort of reaction to the criticism that she's faced over the last few days?
Well, I think let me take a step back. Yesterday, I was at the UBCIC, the Union of BC Indian Chiefs Annual General Assembly. And the chiefs there, and in particular the women's representative, raised with me the fact that we have lost a voice in the legislature of the first First Nations woman ever elected to BC's Legislative Assembly, and their concern about the fact that she described her experience in the Legislative Assembly as a torture chamber. We need more voices in our Legislative Assembly of groups and people who have not been represented there before. Melanie Mark came out of childhood of poverty, lived in the east side of Vancouver, was in care, was the first member of her family to ever graduate from post-secondary education, became the first First Nations woman to ever be a cabinet minister, reformed our legal system through the law school at the University of Victoria to teach Indigenous law and legal orders side by side with British Columbia and Canadian law. First time in the world that has happened. She waived tuition for kids in care to make sure they're able to get into school, got rid of interest on student loans. She transformed our legislative assembly by being there. And she transformed our province in the years that she spent in the Legislative Assembly. It is a concern to me that someone whose voice was so badly needed in our legislature, whose experience was so badly needed, and who was so transformative, felt that her experience in the legislature was torture. That was her experience. And so my part as a leader who wants more Indigenous women involved in politics, wants more groups who have not been represented in our politics to be there, is to listen to her experience and to support her and other people to participate in our political system. It makes our political system stronger. It makes our province stronger. Mel is an amazing leader. She's done remarkable work for the province. I'm incredibly grateful for it. And she continues to have my support, and she will going forward, as she made the incredibly difficult decision to leave politics to support her family when they need her right now.
Thank you, and that's a wrap for the event. I'm going to ask the